Hey, what's going on? This is your boy, Dr. Collins, in one of my segments, Ask Dr. 2. I'm sitting in my surgical suite. And one of the things, man, that I want to talk about today is really about cavities, right? And, you know, patients always come in, Dr. Collins, I ain't had no pain. Why this, why that, right? Listen, your body is so magnificent that God made us so that we're like Wolverines. The Wolverine, we actually heal ourselves, not as fast as he does, but we still kind of heal ourselves, right? So at the end of the day, a lot of times we don't really know you have pain. Like, you don't know you have cancer most times until it's what? Stage 4, right? Well, the same thing with cavities. Most times you don't have this discomfort. I mean, you've seen people, man, with rotten teeth walking down the street. And you're like, man, how in the world this dude can eat? He ain't got no teeth and it's rotten, right? But at the end of the day, he has no pain because your body consistently heals itself, right? So what happens is I want to show you somewhat the stages of the case so you can understand how important it is for you to maintain your dental appointments and come in to get checked so you can stop things before it gets to its worst stage, right? So we talked earlier about gum disease and these bugs, how these bugs, I showed on my microscope over here, on how these bugs actually just infiltrate your mouth, right? It's like termites, right? Gets in your wood, termites get into the wood and does what? Eats away the wood. Well, these termites get into your mouth and eats away your bone and also your tooth structure, all right? So on our end, we'll start off, like, if you can see this little dot right here, number one, it starts off very, very, very small, right? And so what the bug does, it just continues to migrate and gets a little deeper. But you can see this part right here is actually, I'm teaching you something right now. Now I want you to listen. This right here is your nerve and your blood in your nerve, right? And so what happens is, as the cage starts to migrate down towards the nerve, it gets worse, and it will actually get to number 3 where it actually touches the nerve. This is when you start to have pain, and this is when I take all your money. Because right now, you could have stopped it right here and probably just got a filling. Now you come to us, and we gotta do a root canal, build up a crown. Or you might say, well, doc, just pull it because you're in pain, right? Well, then you start to extract things, and guess what now? You're gonna need an implant, and I'll still get your money. So the best thing for you to do is come see me, come see us when we right here so we can just do a filling. Because if you get to this stage or this stage, that's always a possibility. This is definitely a root canal because it actually now has touched the nerve. And this could be possible a root canal depending on how deep the decay is, okay? So if you don't have if you don't have pain, does not mean you don't have cavities. It's just your body is healing itself, okay? It is, though, when it gets to the worst stage, you will have problems. Listen, man, hey, I want to appreciate you guys signing on to one of my segments, Ask Dr. 2. If you got any questions, hit me below. Really appreciate you listening to me. Be Gucci.